Hi, my name is Grayson Cole. I am the third year oral pathology resident here at Pittsburgh. I grew up in central Wisconsin and I did undergrad in dental school in Minnesota. I decided to go into oral pathology because it had a unique combination of both pathology, obviously, and then it also had opportunities for research and teaching, which I also knew that I wanted to be involved with, as well as clinical exposure as well. I decided, so I decided on that those were things that were important to me, and unfortunately, Minnesota did not have a pathology program, so I did a couple externships and gave myself exposure to make sure that this was the field that I wanted to go into. Thankfully, I was correct. And then I looked into several different programs. I chose Pittsburgh because it had opportunities in everything that I wanted: the research, teaching, pathology, clinical, and it is pretty flexible in the degree that you focus on each of those things. Like, there are minimum requirements for the program, of course, but like if you really wanted to focus on clinical, there is a pretty robust clinical oral medicine practice here. If you wanted to focus more on pathology, we've got pretty experts with UPMC as well as experts here that we're learning from, and then teaching and research as well. Like, you could focus more on those as you wanted, and that has worked out pretty well for me, and is why I decided to come to Pittsburgh.
I'm Olivia. I'm the second year resident. I'm a Tennessee native, but I went to dental school at the University of New England in Portland, Maine. I did not know anything about oral path when I got to dental school. My plan was always just to do general, but I really enjoyed the classes that I took in second and third year. So I was strongly considering during those times. I was looking into residency programs and all that. But closer to my fourth year, I started to get a little more gun shy about going to any more school. I was just kind of ready to make a salary, ready to not be a student anymore. And I felt like I had spent all this time learning all this general dentistry training, and I owed it to myself to give that a shot. So I practiced with a corporate practice back in Tennessee for 2 years, and I liked it. I got a lot of good experience, and I'm really glad that I did it, but it wasn't something that I saw myself doing for the rest of my career. COVID was, I don't know, I guess a real soul searching moment. I wanted a career that I was like really, was excited to come back to. So that's when I really committed to applying to residency and decided that I wanted to come back to oral path. So I started putting my application together, mostly during quarantine. The reason I chose Pittsburgh, because I had made, a dentist salary for a couple years. I wanted to do a program that paid. I wanted somewhere that offered a stipend, so I only applied to programs that applied to. And I liked Pittsburgh because it's in a dental school. I didn't really know this when I was applying to residency, but now I know that I want to work in academia and I want to teach specifically and work in a dental school. So I'm glad that I'm in a program where I get lots of exposure to seeing patients in a clinical setting within a dental school, as well as getting a lot of lecturing experience, as well as histopathology, which you get at any program. And so that's how I ended up in Pittsburgh. We really like it. I think that, again, the salary that you make here is a very livable income. I liked Pittsburgh as a city. I came to visit before I started the program, and really liked it. So we're both happy.
Yeah.
We ended up in the right place.